Hello, everyone, and good evening. Welcome to this live session. It's going to be a very brief one. So, if you are online, if you are joining in from anywhere from LinkedIn, Facebook, and which other platform, YouTube. So, wherever you're joining in from, I know it's already late, but if you're joining in, just let me know that you are joining in, and from whatever platform, you can make a comment. You can as well you can as well just hit the like button and any other thing. Yeah, maybe share, because this is going to be a very, very salient, a very important topic to discuss. And I just wanted to get this off my chest. So it's going to be a few minutes and we will be done. So if you happen to come across this video, let me know that you watched it. Let me know that you learned a few things from here, and I'd really be glad. I'd really be glad. So this is what brought about this session I'm doing this night. I've been hearing a lot, not just hearing, I've been seeing a lot. Patients come to our unit, and you know, some of them are gracious enough to tell you where they've been. Okay, they've been to this person, they've been to that person, they've been to those people. They made promises, they did that, they pulled their spine, and all those things that happen. And at the end of the day, it's either they are not getting results or they get momentary relief and they have to keep coming back, and the person literally milks them like milk cows. But that's not even the problem. That's not the problem. The problem is not the fact that a lot of these guys are after your money and they're going to take your money anyways. That's not really the problem. The major issue is the risk involved, the risk of accidents acquired while trying to administer one treatment method or modality or another. Okay? The risk of injury, the risk of injury. I had a patient who, you know, he was on the verge of receiving a massage from an overzealous masseur or masseuse right now, that she had to, I mean, she tore her one of her ligaments, or rather one of her, yeah, tendons. She tore it, she ripped a tendon in her shoulder, and her life never remained the same till date. you know Something that's intense came from a massage parlor. you know so I'm not saying it's not good to go for a massage, or you don't have to do stuff with these guys. No, that's not what I'm saying. But the thing is, ensure that wherever you are going to receive health care in any form, that you are going to the right set of people. Okay, you cannot be going to an eye doctor for toothache. When you go to an eye doctor for your toothache and the eye doctor actually receives you and offers you treatment, he or she is practicing quackery. You have to be able to understand these things and know where to draw the fine line. Okay, so what is currently trending now in Nigeria, particularly in Abuja, is people going to get their necks and backs cracked and pulled and turned and twisted. Very funny and scary thing at the same time. Okay, so you have to be asking yourself, what are the risks associated with what I want to do? Now, any health provider, I'm going to give you a checklist, right, that would help you stay away from people who are not meant to touch you in the first place. Now, any health provider who wants to provide services to you, one, you have to ensure that their licenses are up to date. Their practicing license. Okay, who licensed you? Who certified you? What program did you do that made you see? Somebody can just go to school for 3 weeks and do a diploma and come out and call himself. a chiropractor or call himself a whatever, anything he wants to call himself. Some people will call themselves, they say they are process therapists. I searched and searched and searched and searched to see what the process therapy is all about. No, no resource, no guide, nothing to show that it's actually somebody picks a name and starts doing a lot of Instagram videos. People are rushing. Of course, people actually want something quick, something fast. So they want one size fits all, one time, hit and run. So when you promise people that if they eat this sand, the sand is going to take away their pain forever, and they don't have to exercise, they don't have to change their diet, they don't have to live healthy, they don't have to change their life, their lifestyles. When you promise people that, they are happy with you. So they will eventually rush in. And this is what these people are trading on. This is what they are leveraging on. Okay. So you have to ensure this person I'm going to give my body to, is this person licensed for that purpose? So it's not just to be certified. Oh, I went to school to study this or that, or no, it's beyond that. The certification is a thing, and you're looking at the license. Okay, can I see? It's not bad if you have a private practitioner, or you are going to a place for treatment or anything, and you ask them, can I see your up to date, your practicing license? Can I see can I see your certificate? Okay, you ask certain questions. What's your regulatory body? Which body regulates what you're doing, what you're practicing? Okay, and when they begin to tell you or show you, you will know exactly how to approach matters when any issue should arise. Okay, so it's very, very important for you to know. I talked about certifications and licenses, and then um which other thing? Training, quality of training. You never can tell the quality of care you're about to receive when you don't know the quality of training that person has. For some people, they watch a bunch of YouTube videos and they believe they have become chiropractors, and they start cracking people's necks and cracking people's backs up and down. So you have to be sure, what is the quality of training of this? I mean, what quality of training has he received? What am I even saying? What's the quality of the training he has received exactly before he can be, I mean, he will be able to offer me the kind of service that I'm looking for. Trust me, you don't want to go see a I don't know what to call them now. You don't want to just go see somebody and say, oh, I have neck pain or I have back pain. And by the time they are done, it's either the back pain worsens, or it just gives you temporary relief that you have to keep coming back. And one thing you should watch is this: whenever people make you quick promises, they make you promises of something that will give you a quick fix, and you know, something you just take and the pain goes away forever, and it's just so quick, right? Whenever you see things like that, be suspicious. Okay? Be suspicious. Whenever somebody's telling you, oh, I'm just going to put this, once you put this in your hand or wrap this around your waist, the pain is going to go, and that's all. Or when you visit a what will I call them now? When you visit, I don't want to call them chiropractors because not all of them are chiros. So when you visit some people in their offices, and all they do for you is crack your back, crack your spine, and you go home. Doesn't make sense. Every professional that you are meeting for what you're going through,
Every professional you're meeting should be able to explain what you are presenting. They should be able to offer you some form of education, educational support. Why are you having back pain? Why are you having neck pain? What is this saying? Why is the x-ray this way? What is exactly happening? Why are the lab results like this? They should be able to offer you that information. But anywhere that you go and you see that everybody that is coming, all they do is to just sit them down, lie them down, next thing, crack, 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 everywhere, cracking everywhere. Next, the person is going on. That's not the ideal thing to do. Okay, so you have to also consider all of these things, and learn to trust medical providers, learn to trust your medical practitioners. Okay, I've seen people who, because they felt like healthcare is expensive in hospitals, or because they heard rumors. There's always a way that rumors circulate, anecdotal evidences. Oh, they did it for me. Oh, my mother said that when she was having this, somebody from our village came and did this and that, and people believe such. It's easy to believe those things, but the truth of the matter is, you still need to put some faith on your medical practitioners. You know, People who can give you tangible explanation for what is happening to you, so that even if there's any complication along the line, they will know how to manage it. So I have come to see and experience a lot of cases where people will tell you, oh, I twisted my ankle and I went to a native. He massaged it with a very hot balm, and that night I couldn't sleep. The leg, everything. I noticed that I had serious swelling. My leg swelled up. It couldn't fit a shoe anymore, you know, and it's really, really disturbing. So you see a patient who will tell you, oh, I went to see a native, or I went to see this person or that person, and it worsened. The condition worsened, right? Meanwhile, if they had contacted the right practitioner, the right thing would have been done, saving them all the stress. Now, people who go around running about from one place to another, looking for a solution to their pain, in their mind, never will I go to see my doctor. Never will I go to see a physiotherapist. I don't need them. But eventually, when they finish running around and wasting money, they will now come back again to the physio. By the time they are coming back, it's already quite late. They've damaged one nerve or damaged one blood vessel, or the leg is swollen and rotting up because they tied it with one thing. You listen to the explanation that they are making, and it doesn't really make sense. You know, some people will use razor blades and cut their skin and say it's bad blood that is leaving. Which bad blood? So a lot of false practices are going on, and we cannot depend on the government to clamp down these people. We can't depend on anybody to chase them away, right? Because they've been there for ages and nothing is happening. So it's left for you to be better educated. Educate yourself. Know the right thing to do per time. Know the right professional to see for your pain or for your medical ailment, your medical condition, or whatever it is. Know the right professional to meet, so that you don't make mistakes and throw a lot of money away. Because at the end of the day, you will realize that what you are spending on these guys is way more expensive than if you decide to go for regular healthcare. Okay, so um, yeah, that's it. I promise this was going to be a short one, and I really wish this was impactful in one way or the other, or helpful in one way or the other. I was almost dozing off while talking about all these things, but I just decided to do it because I've been trying to go live for the past how many days. I kept on shifting and shifting, and it's not my fault. I've been really busy. But I said today I must do it. Even if I'm sleeping off, if I sleep off, I'll wake up and I'll do it. Okay. It's really because and what I've been seeing recently, it's scary, guys. It's scary. It's scary. And a lot of people need to be educated. So that's it. Let me know if you watched this, if you came across this video by any means, by any chance, on any platform. Okay, so do well to let me know that you watched it. Leave a like or some, I mean, what else? Share. You can share the video, obviously. Subscribe to my channel on YouTube if you're watching on YouTube. Then what else? What else should I say? Have an amazing night rest, and do not forget, do not patronize quacks. Do not patronize people who you question their professionalism. Do not patronize people you don't trust. Go ahead and see the right professional, the right medical or health provider for whatever it is you're going through. Have an amazing night rest. Okay, so I noticed some people actually joined in live, quite unexpected because it's late. So well done, well done. And if you are joining from Facebook, you can leave a message. You can just leave a message, let me know that you came across this video. You can, what else? You can follow on Facebook, you can follow, you can like, you can share, whatever action you want to take. Good. So yeah, that's it. We've hit the 15-minute mark and beyond. So yes, bye. Good night.